If you are among the nearly 1 million Americans facing a knee replacement, chances are you have a lot of questions and a lot of concerns. But as the commercial used to say, this isn't your father's Oldsmobile. So joint replacement surgery has come a long way. And at Chattanooga Center for Sports Medicine, they are often outpatient procedures. Dr. Tim Ballard is an orthopedic surgeon with the practice. He specializes in these total joint replacements, and so he joins us this morning. Good to see you.
Good morning, good seeing you.
So I think I'm right in saying that most people get kind of fearful when they are facing a total joint replacement, hip or knee, but it has come a long way, right? I mean, to the point that you can do this outpatient. That's crazy.
Yeah, absolutely, and I don't blame persons for being apprehensive about it. It's routine for me, but it's not for them. But things have changed a lot just in the 27 years that I've been here. When I was in practice, to start with, patients used to stay in the hospital for 7 or 8 days with a total joint replacement.
Wow.
And so things have come a long way, and a lot of that's because of anesthesia, a lot of that's because of blood conservation management, and then a lot of that's too is our surgical techniques. And so now I have a lot of patients that go home the same day.
Let's talk about this outpatient center of yours, because
Sure.
as a practice, you're very proud of it, and rightly so. We had a chance to come out there not long ago as it was opening, and it's, first of all, such a welcoming environment when you first come in. You don't feel claustrophobic there.
Well, thank you.
But everything that you need, you mentioned the anesthesiologists, that y'all are all part of that team.
Yeah, we're very thankful. It's something that's been a work in progress for over a quarter of a century. So people may think that we built that in the last 18 months, but we really built that over a 25-year period of building a practice and getting to that point of where we could support a facility like that.
Well, and we are the surgeons. I mean, y'all had a hand, very heavy hand in creating this space so that it's intentional in its use.
Truth.
Okay, let's talk about knees for a minute.
Sure.
Am I right that something like 800,000 Americans will end up getting a total knee replacement, not to mention the ones that don't quite do it?
Right, it's
this
amazing,
year.
and that's per year.
Mm-hmm.
And of course, everyone that comes in with knee arthritis, we talk about non-operative options and go through a thorough evaluation to see what's the best for that patient. But for the person that's got incapacitating pain, bone-on-bone arthritis, and has failed non-operative treatments, that's certainly an option to consider. And so I first want to tell you what a total knee replacement is.
Okay.
So if you think about your knee is made up of the end of your thigh bone or femur and the top of your tibia or your shin bone. And where those two bones come together, they're supposed to be cartilage. Cartilage is like the gristle on the end of a chicken bone. And cartilage doesn't show up on x-ray. So when I look at your x-ray, I should see a black space between those bones. If those bones are touching together, that's what bone-on-bone arthritis is, or osteoarthritis or degenerative joint disease. Those are all kind of the same thing.
Okay.
Now the joint will swell up in response to that. Early on, some anti-inflammatory medication, a cortisone injection, other injectable medications, sometimes bracing may help with that. Physical therapy is unlikely to help patients with that much once they're bone on bone, but that's kind of a synopsis of the non-operative options.
Okay.
And so once a patient has failed non-operative treatment and they have pain that justifies surgical intervention, we will consider putting new surfaces on the ends of the bones. That's basically, in a nutshell, what a total knee replacement is. So I put a new surface on the end of your thigh bone or femur, a new surface on top of your tibia or your shin bone, and a new surface on the back of your kneecap, and then put a fancy plastic spacer in between, and that's a total knee replacement. And that usually takes me less than an hour. You're typically in the surgery center there with us for a couple hours, or if you go to the hospital, you might be there for a night. You typically need a walker for a week or two, and then a cane for a few weeks. But once you're healed, walk, swim, bike, golf, get back to normal activities. And so what you touched on has really been an interesting and exciting thing for us, is seeing people transition to where a lot of them are going home. And so now, for instance, last Friday I did 8 total joint replacements on patients who went home within a couple hours.
Wow.
And when you go home, you're ambulatory, you're up and walking. In fact, I don't let you go home until you can get in and out of the bed, up and down the hall, you're getting on and off the toilet, able to go up and down a couple of stairs. Because I want you to be safe, and then when you go home, I want you up walking every hour. And so when you have someone with you, they're not there to support you physically. They're there to be your cheerleader, to run errands, to drive and that type of thing. But I want you up walking on your own when you go home.
You're throwing a lot of numbers that are impressive out there to me. So one is 27 years in practice. The other is 8 patients on Friday.
Right.
Those are significant numbers, because anybody who ever goes through a surgery and they're talking to the friends, and the friends will say, make sure you find out how many of these he's done. It's really important, because there's probably nothing you haven't seen.
I like to think so, and I'm humbly grateful to have had that practice. I think I've done a little over 30,000 joint replacements.
Wow.
And I prayed that I would have a busy practice when I got to town, and that's what's happened, so I'm thankful.
So we're talking about the knees, yet you also do hips.
I do.
So is this old wives' tale I've heard true, that it seems that people have an easier time almost getting over the hump, if you will, with the hip replacement than the knee replacement?
No, I agree with that, and that's been my experience, and I'll tell you why that is. I think the hip is a little bit more surgery, but frankly, the mechanism is a little simpler. The hip is, for all intents and purposes, a ball and socket joint. And so when you put a new hip in somebody, they tend to feel better quickly. So one of my best friends, I did both of his hip replacements, and he swears both times when he got to the recovery room that deep down pain was gone already. Now, of course, you have some surgical discomfort, but usually it's a pretty good trade for what you had in joint pain soon. The knee, I think, is a little less surgery because, you know, your knee is right there on the surface beneath your skin. It's not that deep of a surgical dissection. However, you have to work hard to get that motion back. And if you're not willing to make the commitment to work hard in physical therapy afterwards, you might want to reconsider having the surgery.
Well, and then y'all have got that as part of your total care, the comprehensive care that you offer at Center for Sports Medicine, because they can utilize your physical therapy team
Correct.
in that recovery.
Yeah, we have a lot to offer that way, and we're thankful for it.
Until you've experienced that bone-on-bone incapacitating pain, as you said, you can't really understand what that truly means, but it is not something, once you're experiencing it, that you want to live through even another day.
I think you're 100% right, and that's why I always put it back to the patient, is that when we talk about options, I don't tell you when it's time to have a joint replacement. You'll tell me. There'll be a time that you say, I'm tired of putting up with this and I want it fixed. I'm not living with this anymore.
Are there people who aren't a candidate for it?
Oh, absolutely. I mean, you have to be surgically cleared. So what we talk about, seeing your medical doctor and or heart doctor if you've got any kind of a history that way. And not everybody that comes in is an appropriate candidate, either because they may get better with non-operative treatment, which is what we'd like to try first, or maybe they have enough other medical conditions that that's not, or maybe it's just not the right timing. So sometimes we send people off for medical optimization, and then once they're healthier, they come back.
It's a full team approach there to the care that you need. So whatever your particular need is in your medical journey, orthopedically anyway, they'll have a doctor who is there to help you. Dr. Tim Ballard is his name. You'll find him at Center for Sports Medicine on Macaulay Avenue, but really all across town. They have multiple practices. 624-2696, online at sportmed.com. Thank you.
Thank you so much.